Hello and welcome. Today we're diving into the world of eye health to discuss a common and often irritating condition, contact dermatitis of the eyelids. Specifically, we'll be focusing on both allergic and irritant types. We'll explore what causes it, how it affects the eye, what to look out for, and most importantly, how to manage and prevent it. So, let's get started. So, what exactly causes contact dermatitis around the eyes? Well, it boils down to exposure to substances that irritate or trigger an allergic reaction in the sensitive skin around the eyelids. In irritant contact dermatitis, the reaction is a direct result of a substance damaging the skin. Common culprits here include harsh soaps, detergents, certain cosmetics like mascaras or eye shadow, preservatives in eye drops, and even prolonged exposure to wind or dry air. Allergic contact dermatitis, on the other hand, is an immune response. The body identifies a harmless substance, known as an allergen, as a threat and triggers an inflammatory reaction. Typical allergens include nickel found in some eyelash curlers or makeup applicators, fragrances in skincare products, preservatives like thimerosal in contact lens solutions, and even ingredients in topical medications. Identifying the specific trigger can be challenging, as the reaction may not occur immediately after exposure, making detective work essential. Now, let's delve into the pathophysiology, or how this condition affects the eye at a cellular level. In irritant contact dermatitis, the irritating substance directly damages the skin's protective barrier. This damage leads to inflammation, which causes redness, swelling, and itching. In allergic contact dermatitis, the process is more complex. When the skin is first exposed to the allergen, specialized immune cells called T cells become sensitized. This means they learn to recognize the allergen. Upon subsequent exposure, these sensitized T cells release inflammatory mediators, such as cytokines and histamines. These mediators trigger a cascade of events, including vasodilation, increased vascular permeability, and recruitment of other immune cells to the area. This results in the characteristic signs and symptoms of allergic contact dermatitis: redness, swelling, itching, and sometimes even blister formation. The eyelids, being particularly thin and sensitive, are especially vulnerable to this inflammatory process. Contact dermatitis of the eyelids is a relatively common condition, affecting individuals of all ages and backgrounds. While precise epidemiological data for eyelid-specific contact dermatitis can be limited, general contact dermatitis prevalence studies suggest it accounts for a significant portion of dermatological complaints. Certain professions, such as hairdressers, cosmetologists, healthcare workers, and individuals frequently exposed to chemicals or irritants, may be at a higher risk. Similarly, people with a history of eczema or other allergic conditions are also more susceptible. Understanding these risk factors can help in both prevention and early diagnosis. The signs and symptoms of contact dermatitis around the eyes can range from mild to severe, depending on the individual and the severity of the exposure. Common symptoms include redness, swelling, itching, burning, and scaling of the eyelids. The skin may appear dry, cracked, or even thickened in chronic cases. In some instances, small blisters or fluid-filled bumps may develop. The itching can be particularly intense, leading to scratching, which can further exacerbate the inflammation and increase the risk of secondary infection. Importantly, symptoms are typically localized to the area of contact with the offending substance, although they can sometimes spread to surrounding skin. If left untreated, contact dermatitis can become chronic, leading to persistent discomfort and potential complications. Diagnosing contact dermatitis of the eyelids typically involves a thorough medical history and a physical examination. The doctor will ask about your symptoms, potential exposures, and any history of allergies or skin conditions. A careful examination of the affected skin is crucial to rule out other possible causes. Patch testing is often the gold standard for identifying specific allergens responsible for allergic contact dermatitis. This involves applying small amounts of various allergens to the skin, usually on the back, and monitoring for a reaction over several days. Identifying the causative agent is essential for effective management and prevention. We can classify contact dermatitis into two primary types: irritant and allergic, as we've already discussed. Irritant contact dermatitis is caused by direct damage to the skin from a substance, while allergic contact dermatitis is an immune-mediated reaction to an allergen. Recognizing which type you are dealing with is important because the treatment approach may vary slightly. For example, while both types benefit from avoiding the offending substance and using emollients, allergic contact dermatitis may require stronger anti-inflammatory medications. Treatment for contact dermatitis of the eyelids focuses on relieving symptoms, reducing inflammation, and preventing further exposure to the offending substance. The cornerstone of treatment is avoidance of the irritant or allergen. This may require careful detective work to identify the culprit. Gentle cleansing of the eyelids with mild fragrance-free soap and water is important. Cold compresses can help soothe the itching and reduce swelling. Topical corticosteroids, prescribed by a doctor, are often used to reduce inflammation. However, long-term use of topical corticosteroids around the eyes can have potential side effects, such as glaucoma or cataracts, so they should be used cautiously and under close medical supervision. In severe cases, oral antihistamines or corticosteroids may be necessary. Emollients or moisturizers help to restore the skin's barrier function and prevent dryness. Prevention is key to managing contact dermatitis of the eyelids. The first step is identifying and avoiding potential irritants or allergens. Read labels carefully on cosmetics, skincare products, and eye drops. Choose hypoallergenic and fragrance-free products whenever possible. Perform a patch test on a small area of skin before using a new product on the eyelids. Avoid rubbing or scratching the eyes, as this can further irritate the skin. Use gentle cleansers and avoid harsh soaps or detergents. Protect the eyelids from wind and sun exposure by wearing sunglasses and a wide-brimmed hat. If you wear contact lenses, follow proper hygiene practices and use preservative-free solutions if you are sensitive to preservatives. The prognosis for contact dermatitis of the eyelids is generally good, especially when the offending substance is identified and avoided. With proper treatment and preventative measures, most people experience significant improvement in their symptoms. However, chronic or recurrent exposure can lead to persistent inflammation and discomfort. Recent research has focused on developing new and safer topical anti-inflammatory medications, as well as improved diagnostic techniques for identifying allergens. Advances in understanding the skin's barrier function are also leading to the development of more effective emollients and moisturizers. Continued research in this area holds promise for better managing and preventing this common condition.